I'm Dr. Surbhi Kudyar. I'm a breast surgeon.
Why does cancer occur?
What you've asked me is $1,000,000 question. We have a body, it's made up of cells. And once these cells forget their own functioning due to some reasons, and those reasons are our created reasons.
There's something called as painless lump and a painful lump.
Pain is the major symptom which usually a female comes with. But I would say there is a lump. Maybe there is no pain in it, but a female can appreciate that there is something wrong in the organ.
Welcome to Dopamine High.
Hello,
How are you feeling today?
I'm great. How are you?
I'm good too. Can you introduce yourself for the audience, please?
Yes, sure. I'm Dr. Surbhi Kudyar. I'm working as a consultant breast services at American Oncology Institute, Jammu. And I'm a breast surgeon who looks after the breasts of the females.
As you mentioned that you're a breast cancer doctor. So can you first explain why does cancer occur?
See, what you've asked me is $1,000,000 question. So, if anybody answers that, owns a Nobel. So, but I tell you one thing, it's on us. We have a body, it's made up of cells. And once these cells forget their own functioning due to some reasons, and those reasons are our created reasons. So if those cells, they forget their function, so they become an outlaw. So once they become an outlaw, they are not functioning their own function. So they keep multiplying themselves, and they keep multiplying themselves in a fashion that they become a mass, or what we call a lump,
Right.
and they manifest as cancer in the body. So they are basically our own cells, those who have forgotten their own work. So they are not functioning as they had to function in a body.
So there's something called as painless lump and a painful lump.
Right.
See, painful, we realize that, we're having a pain, we need to go to a doctor. If it's painless, how do we go about it?
See, pain and painless. Pain is the major symptom which usually a female comes with. And they always say that maybe during breastfeeding, or maybe once I touch my breast, I experience some pain. But as you talked about the painless lumps, but I would say there is a lump. Maybe there is no pain in it, but a female can appreciate that there is something wrong in the organ. And that wrong is just like a small coin or a small pea piece, or just like a walnut in your breast. So I think that feel matters. That is why we always, what I advocate is that one should do a breast self-examination. That is that examining your own breast every month. And if one does that, see, wherever the shoe pricks, the person knows who's wearing the shoes. So likewise, the female, she should feel her breast every month with her own fingers. And if she does that, it hardly takes a minute or so. And if she does that, that makes her realize that there is not something wrong. It's not just the pain which needs to be elicited, but it's actually the texture, the feel which needs to be elicited. That there is not something which you feel, a lumpy feel, what you say, right? Like a thermocol you hold, it is like soft somewhere and a harder part somewhere. But yes, you feel a ball inside. So if that feel comes in your breast, so that is alarming. And then feeling it to be painless or painful, that's a secondary issue. But yes, one should feel their breast every month. And that feeling of breast should not be somewhere near your menstruation time. Why? Because at that time, usually the breasts are quite swollen. Once you started menstruating, after 4 or 5 days of the menstruation, this breast self-examination should be initiated. And in the females, those who've already attained menopause, that choose any day of the month and do that breast self-examination.
Talking about menopause, does it said to be that most female during or after menopause tend to get breast cancer. Is that true?
Not exactly. It's not like that. Yeah, there are young females also, those who have this breast cancer. See, if I say
But does the chance during that time increase?
no,
Okay.
no. See, if I talk about books, they do write that yes, could be due to the sudden cessation of the hormones in the body and all. There are sudden influx, and we have such things cropping up. But I think nowadays it's less genetic than lifestyle.
Okay.
So it's just 70% which are non genetic, and it's just the 30% which are genetic. So if we have such a disparity nowadays, so how can you say it is the menopause which is responsible for this and it is not the puberty which is responsible for it? So saying like for puberty or menopause, that would be a little dicey.
You just said lifestyle. What are the food intake that we should do in order to avoid cancer?
See, food intake nowadays, it's like healthy lifestyles. Healthy lifestyle means a lot of ragi, lot of quinoa, and a lot of veggies and a lot of things. Now we have a lot of colorful food in the market and all. But I would just say one thing: what our dadi nani used to eat. A lot of now we don't call it ghee, we call it clarified butter. So what we take is we take clarified butter. So it's normal ghee, which even our dadi nanis take it till date. So eat a lot of things which are actually our lifestyle.
Right.
Don't put yourself in shoes of others. What is our body acclimatized? See, we are an Indian setup, and an Indian setup is a lot of dal, lot of vegetables, and a lot of rice, and this is what is our staple food. So I think we should go with that.
Mhm.
So if we turn on our tables to the other side, so the other side also turns towards us. So I think what you talked about is like food. Food should be healthy. As we were small little kids, we used to read about a triangle, a balanced diet triangle. So what was that balanced diet triangle? There used to be fish, there used to be milk, there used to be eggs, butter. Said what these are fats. Then we have carbohydrates का एक triad आता था. फिर then we had proteins का triad आता था. So according to the body's weight, there are specifications that how much fats your body need and how much proteins your body needs. So one can chalk out that and get into a good healthy diet. It's not eating all those fancy foods or something like I just take proteins. I am on a keto diet. See, and see, we always see the goody things. We never see the deleterious parts of it. Somebody who's on a keto diet, a very high protein diet, do you know how deleterious it is towards your kidneys? But we don't feel that. Why? Because we need that crash diet course. No, I need to get size zero. It is not being size zero, it's being healthy.
Mhm.
So once somebody is healthy, healthy doesn't mean size zero. Again, I would say that.
Yeah, agreed.
So be healthy, eat healthy, and eating healthy doesn't mean fancy foods. It means a normal Indian staple food and Indian diet, which we have. A lot of condiments. See, now we have methi ka pani, we have jeera ka pani, we are taking a lot of cinnamon in our food. But this was already there in the Indian food. We had a lot of condiments. Whenever somebody used to travel to Kerala or these places, South India, they used to always say, get me those elaichis, get me those lot of spices and everything. I want to have Javitri. So this was all, everything was there and everything has been used in our Indian kitchens. But I think now we are using something different. So how can you see? I have already heard that बाजरे की रोटी
हाँ जी.
ना हमारे में जैसे होता है ना ये चीज़ गर्म है ये ठंडी है सो दे ऑलवेज हैव दिस इज हाउ द फूड इज डिफरेंशिएटेड इन आवर हाउस होल्ड सो ठंडी चीज़ें जो हैं वो नहीं खानी है गर्म चीज़ें बाजरा इज बहुत गर्म होता है सो if we take those bajre ki roti and everything at this point of time, don't you think that will be somewhat not advocated? But अब वो एक फैंसी फूड है, अब वो बाजरा वो नहीं है जैसा पहले था, सो बट वो एक फैंसी फूड है, वो लेना ही लेना है. सो दैट शुड नॉट बी द थिंग. प्लीज स्टिक टू द नॉर्मल डाइट, घर का खाना. दैट्स व्हाट आई से. सो वो बड़ा कम है आज की डेट में. नॉट इवन फॉर चिल्ड्रन, दे इवन थिंक कि टेकिंग अ टिफिन टू स्कूल इज अ स्टिग्मा नाउ.
And what are the things we should avoid?
We should avoid a lot of junk food. I cannot say that you abstain from junk food. That is not possible at all, right? So if I ask my children also, ki don't eat pizza, don't eat burgers, they're going to say we're going to change the mother. So it's the thing, bro. So I cannot say that junk can be overruled altogether, but that needs to be reduced. A lot of caffeine. Caffeine is not just in the alcohol. See, there's a culture, I take only black coffee. And that black coffee demands 7 cups a day. Now tell me what is this? 1 or 2, I understand. I don't take sugar, I don't take anything, but I take black coffee. And all the time we're on the phone, and the phone is right here, isn't it? So जब हम छोटे होते थे ना, so everybody used to say फ़ोन की ना रेडिएशंस होती हैं, वो रेडिएशंस जाती हैं. सो अभी भी हम देखते हैं ना कि बच्चे बहुत ज़्यादा जो फ़ोन देखते हैं या कुछ, सो रील्स एंड एवरीथिंग, सो they get so much of like their brain gets stimulated so much that they get an addiction to it. So what is that actually addiction? वो एक चीज़ है जो आप अपनी तरफ खींचती है. सो हर गलत चीज़ अपनी तरफ खींचती है. सो वो चीज़ें जो हैं, एंड अ लॉट ऑफ जिम कल्चर, a lot of stretching exercises, a lot of heavy weight lifters. Even the girls are doing those weight lifting. Why? Because they want all those toned bodies and everything like that. So that needs to be metered.
Right.
So one needs to do it. If you are hitting a gym, first of all, the thing is that what is the thing which is required by your body? It is not that you're going to do, if there are like 10 machines in the gym, so all the 10 machines you need to hit down. No, not that. You have, that gym person has to specify that your body is of this type, and this is your body mass index, this is your protein intake, and this needs to be your carbohydrate intake. And since you are a little lean thin, you only need toning exercises, so you need not to lift up all those heavy weights and everything. So you have this set of exercises. So that needs to be specified, and that needs to be metered.
Right.
So that is the thing. We are just following the flock. We are not thinking that what is the actual requirement of our body. So if we go with our body, I think that would be the only saving part. That would be the savior, thing, that yes, we are doing something for ourselves. That goes for food, that goes for exercise. And a lot of stress altogether, that I need to do this, I need to do that, I need to finish up my course. So see, the food which our body is acclimatized, we are not giving that food to the body. The exercise which our body needs to get, the little walk and a little small exercise for just 40 to 45 minutes, that we are not giving to the body. A lot of stress, always. Stress of work, stress of home, stress of children, stress of family. So you are, not there in your right senses, right? And third part is that once, see, how does the body work? The body works with the food we eat, the water we take, and the atmosphere what we give to the body. So all the things which we are giving to the body is not appropriate. So how would the genes and how would the cells function properly? They are not getting that exact place to flourish. So obviously they will also forget about their function. So उनको जो मिलेगा वो उसी के हिसाब से चलेंगे. So हम जो गलत उनको देते जाएंगे वो भी गलत होते जाएंगे. So that's how things manifest. And that is the answer to the question to everybody who asks, मुझे क्यों कैंसर हुआ? हमारी फैमिली में ये नहीं था, लेकिन मुझे क्यों ये हुआ? So this is the answer to those questions. And secondly, the last thing which I would say, that some people are like, they say हम तो किसी के घर का पानी भी नहीं पीते हैं, लेकिन फिर भी मुझे हुआ. So in that cases, it's just like an accident which can happen to anybody. So that's a, it's a collective thing which happens to the body, and finally the body resists that now I cannot take it anymore, and I'm going to crop up with something else. So that comes out in the form of cancer.
Recently, there was this lady who messaged on one of our podcast reels, and she said because of trauma, she got breast cancer. How is trauma related to cancer?
Trauma, a physical trauma or a mental trauma? See, as I said, stress. Stress is a very big, one of the reasons in females. And secondly, what is the thing? Main stress is of what? That if I have something, so who's going to come up with the finances? And who's going to take me to the doctor? And will I reach at the right time? See, these are the major brunts on the female. And the last thing is that despite of all financial support also, would these medicines work on me if I have so and so condition? And finally, if I succumb, what will be the fate of my family? Who will look after my children? Who will look after them? And I am already in a battered family or in a battered relationship. So how would I go about? So this is the major, hormonal uthal-puthal जिसको हम बोलते हैं ना, imbalance. And that imbalance leads to all these things. So that's what I'm saying, no? Like 70% of them are non-genetic. So how come these things are cropping up? Right. So we are not actually giving them a favorable place. So we are always preoccupied. I would say that. Like maybe I'm sitting here, but in the back of mind, I'm having a trouble somewhere down, maybe in the office, maybe in the home or something, and that is troubling me from inside. So that trouble keeps on nagging you always. And we've always heard about, वो कहते हैं ना, रस्सी भी अगर पत्थर के ऊपर पड़ती है तो पत्थर के ऊपर भी निशान पड़ जाता है. So we are just humans. So of course could be one of the reason, but not just one reason for breast cancer. I won't say that कि breast cancer उन्हीं को होता है जिनको बहुत ज़्यादा stress होता है. ऐसा नहीं है. Could be one of the reasons, but yes, one needs to evaluate about it also.
Right. Nowadays, we live in this culture where girls are smoking, drinking. It's really out there and people are open about it. So, is smoking, drinking causing cancer?
See, whenever some males used to ask, no, so the first thing we used to put down a question, आप cigarette पीते हो? Do you smoke? Do you take alcohol? So, but I would say the unfortunate thing is that now this question goes to the females also.
Right.
So yes, that has a brunt on the females.
Okay.
See, they have a brunt on their conception. They have a brunt on their menstrual cycles. So once these two physiological things, these are not some diseases in the female body. These are the normal physiological things which are happening in the body. And once these physiological things get hampered, so they ought to create some problems. And overuse of contraception. See, everybody wants a good, healthy lifestyle, and they don't want children at their. They want children at their discretion. They don't want it to happen by chance. They want that once we plan, we get the child. And if it's a child who's unplanned or something, then take a contraception and get that washed out. I think that is the thing which is again a problem.
Okay.
So overuse of contraception, no breastfeeding, early menarche, that is early puberty in small little girls, and late menopause. They are also the major problems which females create for themselves. And these are actually created. I won't say that the breastfeeding, that you're not breastfeeding your child is physiological. That is something which I did not do or somebody did not do that. So why you did not do, that needs to be asked. Yes, there are females, they always say, Doctor Saab, हमें इतना दूध नहीं आया. that can be understood, that is something physiological कि उसको इतना ज़्यादा milk नहीं आया. But those who are lactating, जिनमें है milk, then what is the problem that you don't breastfeed? So that is again why, because it's early joining to the hospital or to the office or anywhere like that. So the lag time and the time where when you are in the at your workplace is that time you cannot give that milk to the child.
But does that cause a problem?
Yes, that is one of the reasons. See, anything which is natural, we are cutting it down. See, we are getting the milk, but we are not, giving it to the child. Earlier, it used to be like that boosts the immunity of the child.
Right.
The more you breastfeed the child, that would boost the immunity of the child. But if the child is just breastfed for the month or so, how would you boost the immunity of the child? So that's again, so you are taking drugs to stop your lactation, and that actually happens. So if you are creating some problems in a natural thing, so that is something that needs to rebut back. No? So wo ho gaya. Then, as I said, we have early menarche. That's puberty is very early. It's like 8 to 9 years. Small little girls, they are hitting for their menopause, for their menstruation, and they are not even aware of what it is and what it is not. So what is it? It is juvenile obesity. It is their junk food habits, the lot of sugar foods, the little candies which they take, the so much sugary food which they take, and all that things, they crop up and they create these problems for the small little girls.
Right.
So if you have a girl who's starting menstruating at the age of 9, and then she has some problems, like again the lifestyle is the same as she's following earlier also, all that junk and everything, कोई बात नहीं, बाद में देख लेंगे, we'll hit the gym, हम dieting करेंगे, हम ये करेंगे. So see how much trauma you are giving to your body.
Right.
So just analyze that. So if we analyze those things and we realize that we have a small little petty body and that doesn't demand anything out of us, but what actually we are putting inside and what we are giving is all just trauma.
Right.
Trauma by food, trauma by mental health, trauma physically, everything.
What are the early signs of breast cancer?
See, early signs of breast cancer is like, first of all, is lump. We are dealing with an organ that is just a fat ball. There are no bones inside. That's a fat ball which is resting on a muscle, and there are muscles and there are bones underneath the muscle. But the breast itself is just a ball of fat. So that has a very doughy feeling. Atta, whenever we have whenever we knead the dough, atta gundte hain, so we have a feeling of a doughy feeling. So that soft doughy feeling is the feeling of the breast, what you can say, that a very soft tender feeling. But whenever you see a lump is like a gant, एक छोटा सा, मतलब एक छोटे से मटर के दाने के जितना हो सकता है, या फिर अखरोट के जैसा हो सकता है, या फिर एक कॉइन के जितना हो सकता है. And that not just in the breast, but in the armpit also. Right? It's not just the one part which one needs to, examine in herself, is the armpit also.
Okay.
Why? Because from the breast, we have nodes. They are called as lymph nodes. And those lymph nodes also get, affected by any sort of a pathology in the breast. So there's anything which is there, that they become reactive. Either if we have infection also, then also they get affected. So that is the thing. So it is not just the breast, it is the armpit area, which is called as the axilla. We always see for that area also. And we actually insunate our fingers and we, palpate them, by our hands in a circular motion. And that's how we feel the breast. That's the lump. Usually, as you said, it could be painless. At times, may be painful. Why? Because could have got infected, some super added infection or something, but that's quite rare. And then we have, there is like the skin over the lump gets pinched in, right? We feel that there is something. Okay. And secondly, what we have is that could be the nipple deviation, nipple retraction inside. And sometimes what we have is that females, you say that they say हमें ना dermatitis हुआ है breast पे, and we have a lot of itching. They use a lot of antifungals, they use steroids. थोड़ी देर के लिए वो subside हो जाता है, but after some time that again crops up. And if that crops up in the skin, that needs an evaluation. And at times that changes into a different color also. There are some color changes also. And if it gets a little more advanced, then you have the breast skin feels like an orange peel. That's called this pewdy orange. That really looks like an orange peel. There are like small little specks on the skin. And that actually feels that no, now things are not right in the breast. So one should not, take up the things to that level that where we cannot go back.
All right. So a lot of people get themselves massage. So is that good?
That has no relation to it. No, nothing.
But like you said that we have these nodes and you have lymphatic. तो बोलते हैं कि when you get them massage वो drain होता है. So it is good for you.
बिल्कुल वो होता है, that's good for you, but that's for anybody. Normal person going for a massage, a healthy massage, that's all right. That's nothing to be done with that. But yes, if some female has a pathology inside and she's been operated on the breast, and say somehow the lymph nodes are being removed from the armpit, so then massage is not advocated. Why? Because we don't have the draining channels anyhow left inside. So what we're gonna actually do is that there is no channel which is allowing the lymph to flow inside. So that lymph will like come all in the subcutaneous area, and that subcutaneous area will become swollen. That is why you would have seen in females, those who had breast cancer, the affected side is usually swollen.
Mm-hmm.
So why is that? That is due to the lymphedema. Why? Because we cut all the lymphatic channels, we take out all the lymph nodes. So that is one of the biggest complications of cancer surgeries, breast cancer surgeries.
So there's something called biopsy.
Yes.
What is it and why is it done?
If any female comes to you and she says that I have a lump in the breast, how is that evaluation going to go further? We need a tissue diagnosis. So for that tissue diagnosis, we go for a needle test. We go for a fine needle aspiration, or we go for the biopsy. Earlier, that biopsy used to be like giving a proper cut and then taking out the tissue from inside. But now that is an obsolete procedure. What we do is we have a little, we have a fine needle aspiration. I said, वो पतली needle होती है, उससे थोड़ी सी मोटी एक needle होती है, and that has there's a mechanism how that gun works, and that's a biopsy gun, what you say. And with that mechanism, without any cut or anything, we take out the tissue and we do that tissue diagnosis. See, every lump in the breast cannot be labeled as a cancer.
Right.
So that needs to be evaluated. And before labeling a female with cancer, you need to have a thorough tissue diagnosis. So just to take that step, we do this biopsy test.
You spoke about breastfeeding. So can somebody having breast cancer feed their child during this time?
No. And during breastfeeding, breast cancer crops up.
Okay.
Yes.
Why is that so?
It's like, see, as I said, pregnancy is again a big physiological brunt, a hormonal brunt on the females. And that has been seen that during lactation, हम लोग कहते हैं ना, इसको दूध की गांठें बन गई हैं. So usually that gets missed. There could be cancer inside.
Okay.
And the exact phenomena, if you ask me, that's all because of the hormonal influx and the outflux which is going on in the body.
Okay.
So at that time also, ladies crop up with breast cancer, and that is usually missed Why? Because they take it as galactoseals. Galactoseals are milk, दूध की गांठें जिनको हम बोलते हैं. So वो उनको मिस कर देते हैं और फिर वो दाई से या whosoever comes for their massage and all, they ask them to please remove these by this massage and everything. So वो remove होती नहीं है, and by the time they realize that no, अब ये जो गांठ है ये नहीं जा रही है, so that needs an evaluation.
Okay.
कई बार females land up with abscess formation also, but that is not cancerous, या उसको साथ कैंसर हो सकता है, ऐसा नहीं होता है. बट अगर कोई भी दूध की गांठ जैसी लगे जो लैक्टेशन के टाइम पर मसाजिंग से या दूध पिलाने से भी नहीं ठीक हो रही है, दैट नीड्स एन इवैल्यूएशन.
Okay.
Yes.
Is cancer hereditary?
Yes, it is.
Okay.
One needs to evaluate that if, say for example, the mother had breast cancer, so was she the gene positive, that gene which is associated with breast cancer? If yes, then the children and all the siblings, that they all need to be evaluated for that gene.
So is there a gene test?
Yes, there is a gene test. There are a lot of gene tests which we can undergo, and this is something which is always kept confidential with the family. Why? Because if any female comes out to be gene positive, it's not necessary that she's going to have cancer. She's just gene positive. So gene positive means that she has that preponderance, and she has that, she is somewhat prone to that disease. She will have that disease 100%, that is not for sure. So for that, she can go for risk reducing surgeries, like she can save herself, and we can always put her into a surveillance group. But I again say that if somebody is gene positive, that doesn't mean that 110% that no, she's going to have cancer now the life is going to end up. Why? Because she's gene positive? No, she's going to have cancer. No, it's not that. One needs to know that yes, I have gene positive, like as I was discussing earlier also, like we have Angelina Jolie. She got her risk reducing surgeries done, bilateral mastectomy with reconstruction, and getting her uterus removed. So since she was that gene positive, that is the BRCA1 and BRCA2, that's BRCA1 and BRCA2 genes, they are mainly associated with breast cancer, and they're even associated with other cancers also, but mainly with breast cancer. So if these genes come out to be positive, then we ask the female that if you want to go for a risk reducing surgeries where the ovaries are removed and the breasts are removed, bilateral breast and bilateral ovaries, dono breasts and dono ovaries, they both are removed. So if they find it suitable and they find it possible, so many of the females, they get it done, or they get themselves enrolled in the surveillance groups, and they are under the strict surveillance of the doctor.
So you talked about tests. Which are the tests that we should go for when we come to know that we are gene positive?
See, that's just the genetic test which we have, and that is through the blood itself. That is not some tissue diagnosis or something. That is with the blood, and that is the only test which is there.
No,
the
like
gene
what
test.
is next?
What
step?
next?
Yeah.
Next step is first of all, is the counseling of the person. Why? Because if you ask somebody, I tell you one thing, labeling somebody and asking that lady that you have breast cancer is a very, very, it's a psychological brunt.
Right.
Both on the patient and the family itself. And finally, once you break the news, no, that's for 100% sure he or she has cancer. So the second thing which comes to their mind is that, oh my God, Dr. Saab, ये कौन सी stage है? अब हम किस stage पे इसको क्या पकड़े और इसको हम क्या कर सकते हैं? As you talked about early breast cancer. So यहाँ पे I would say that here the main awareness part needs to be done.
Right.
हम जितनी जल्दी इसको पकड़ेंगे, हमारे पास उतनी ज़्यादा मोडालिटीज़ ओपन होती हैं, और जितना ये लेट होगा उतनी ज़्यादा हमारे पास मोडालिटीज़ क्लोज हो जाती हैं. We have very less to offer to the female. If it is early, in those cases, what we can do is that we can at times forego chemotherapy also, and we can save the breast by surgery, and we can remove only that cancerous lump and the lymph nodes, and the whole breast, as I said, with oncoplasty, that can be saved, and somewhat reconstruction which is required, we save the breast and the whole feminism is maintained in the female. But that is usually in early breast cancer cases. But since it becomes a late or a metastatic stage, what do you call a metastatic stage is that it is no more in the breast. It is there in the breast, but no more confined to the breast. It has moved to the other organs of the body also. Maybe the contralateral breast, or to the bones, to the liver. So these are the other things, other places where this breast cancer can manifest. Long back, I had a female, she had backache like anything. She used to travel, she had almost traveled to Ludhiana, Amritsar for backache. So her MRI was done and everything was, they said there is a lesion.
Okay.
So that needs evaluation. So then somebody told her to get a PET scan done. PET scan is like a full body scan. So she got a PET scan done with us. And finally, what there was that she had a lump in the breast. And that breast lump was causing that pain. Why? Because that has metastasized to her bones.
Okay.
So this is not just one thing which needs to be, it has to be like everything. Whenever a patient drops into you, you have to ask her about everything. You
Every
have
part of your body.
Yes. It is not just the breast part which needs to be taken care about. That has to be everything. Because in breast cancer, it is not just one type. Breast cancer is further categorized. In some categories, it is like hormone positive, and the other category in which it is hormone negative. The hormone positive is a little good entity and which has a lower risk of coming back. Whereas the hormone negative, the triple negative, that has a tendency to come back. And that has a very less to offer to the females. And then we have, see, a female has many things to do. She has to bear children also. She has to breastfeed. And if, say, for example, at a very early age, she has breast cancer, how would we say, will she ever conceive?
Okay.
Then comes the conception part. It is not just the cancer which causes the brunt on the females. It is basically these other things which causes a brunt on them. That doxa, would I ever be able to conceive thereafter? Or if I bear children and if that comes out to be a girl child, would she be prone to that breast cancer?
Right.
So these are the actual psychological questions which the female comes up, and even the family comes up. So they need to be addressed. So as I said, there are different categories of breast cancer. In few categories, yes, conception is possible. And in some categories, conception is not possible. And secondly, in young females, what we say is that you can go for in vitro fertilization, that is the IVF. You can save your eggs. So you can get them freezed with the gynecologist or the one who does the IVF. And then thereafter, once your whole process of the cancer treatment is complete, and then thereafter, you can go for your conception. But that is only for a set of patients, not for all females. That depends upon the category of breast cancer which they are falling in.
Okay.
So that's how that works.
Okay. Talking about immunity, there are people who are smoking, drinking, and they have no issue with cancer. But there are some people who are clean, but they tend to get cancer. Why does that happen?
That's an accident, can happen to anyone. Because what we used to hear from our dadi nanis, it's like they used to say it's a curse of God, it's the karmic role which is coming up in front of you. So I think that's not the thing which actually is, but it's like it can happen to anybody, and how your cell behaves and how they don't behave, that doesn't depend upon us. They depend upon themselves. वो उन cells पे depend करता है. So I think उसके लिए कुछ भी कहना बड़ा difficult होता है. As a doctor also, and maybe as a layman also. उस चीज़ को समझना और उसको समझाना, ये दोनों बहुत difficult है.
So a lot of people, especially in the industry, in Hollywood for that matter, we look up to these celebrities, but they are really enhancing the concept of implant.
You're absolutely right, and you've hit the bullseye. So implants are I would say they're the need of an hour also. Why? Because there are two things. One is for the enhancement, as you said. It's not just confined to the celebs. It's for everybody nowadays. And it's more of an aesthetic value that I have to look more feminine,
A certain way.
assertive, and that gives you more confidence. So, but as I said, everything has a pros and a con.
Yeah.
So what we've heard about that implants, it's not that every implant works, and every implant works for everyone. For every person and every body, there is a different set of implants, and that needs to be chalked out with the patient for what purpose are you taking it. As we were talking about cancer patients, for them, again, implants are advocated, but when and what, that needs to be discussed. And for the breast enhancement, for the aesthetic values, the implants, they are different. And see, implants have a lifetime. They are not for lifetime. So that again needs to be told to the person who's getting it done. So if we compare our lifestyles with the celebs, so that's not possible. So one has to, if we are idolizing somebody that yes, she's got that thing done. So we need to understand that if we put ourselves into her shoes, so do we stand there? So that means that needs to be understood. The ground level reality about the implants, that yes, no doubt implants, they are revolutionized the whole industry, and that has given that much of feminism, the assertiveness that is there, no doubt. But as I said, we have two facets of the coin. So the other facet needs to be addressed too.
On the contrary, there are a lot of people, because of the aesthetic, we want to look thin, and then we want breast reduction. So is it good for health?
See, first of all, one needs to understand that breast reduction cannot be unilateral. It's not that you reduce one side of the breast. That has to be bilateral. So, and that has to be a proper surgery. That is not like, it's just one day procedure or something like that. No. That has to be a proper surgery in which the tissue from the breast is taken out, and that cannot be replaced back. Fine, just understand my words. We take out that tissue and we reconstruct the whole breast into the size what the person wants, and that tissue which we have taken out cannot be replaced back. So that natural tissue we take out, and that further cannot be replaced back. And the contour and the size which we have attained now, that cannot go back to.
Okay, so that remains for the lifetime.
That remains stable. Why? Because that is reconstructed. That is not natural. So the reconstruction part stays in. That has been sutured, that has been glued, a lot of things, right? So that stays what we have done, the reconstruction. Few of them actually very totic, very saggy breasts. Yes, that needs to be addressed. Why? Because some feel that they don't look good, or they look too fat with it. I can understand that. But there are young girls which are coming up with this, that they want breast reduction, and there are few who want breast augmentation also. So at that time, I would like to say that abhi aap patle hue ho kuch crash diets se, but thereafter, if you resume your own body shape, then how are you going to get back the breast size?
Agreed.
So that remains stagnant. That will remain there. That will not grow further. That may grow a little, but not to that extent how it was earlier. So that is the thing.
Anybody under the age of 18. So, what are these girls supposed to do when they find a lump in their breast? Is it alarming?
Actually, not. See, as you asked, under the age of 18, they are basically called as adenomas. They are the fibroadenomas, which are due to the like some developmental issues. They are there in the breast, and then there's a sudden influx of the hormones because of their puberty. So they start developing these small little lumps in their breast. They could be unilateral or could be bilateral also. So, as you said, is it alarming? It's not alarming. They don't become cancer, and they are not even cancers. They are called as fibroadenomas. Now comes a question that they become panic. Docs, please take it out. Otherwise, this is going to grow inside and this and that, and this is going to become cancer. The first and the foremost thing that every adenoma needs not to be excised. First of all, we need to think that how and why did this adenoma crop up? Was that the dietary habits which needs to be addressed? A lot of the technology being used, a lot of caffeine intake, the junk intake of the child. What is it which is causing these things in herself? Or at an early age, they start the stretching, some dancers. Yes. So you have those, the moves are like stretching, So they have these problems. So, or some gymnasts.
So, does this die down on its own?
At times, they do die down at this on its own, but कई बार ये नहीं भी खत्म होते हैं. So, अगर ये खत्म नहीं हो and you feel that they are growing,
right,
like after 6 months, you again see that there is an increase in the size of the lump, then they need to be excised because they have a chance of recurrence. So we cannot, like at a 14 years of age, we have a little girl and we say, no, isko hame nikalna hai. That's wrong. That's not right practice. We need to understand the things and then we should go about. And yes, if the lump and the breast ratio is not corresponding, if we see that lump is increasing in size and the breast is remaining small and it's not growing from that part, then could be another reason that we take out that lump. But on the first go, don't do that. Again, it can become, there are chances of recurrence, as I said, and again I would say that they are not cancerous. They are normal hormonal changes की वजह से अगर कोई गांठ बन जाती है, सो वो फाइब्रोएडिनोमास होते हैं और ये बहुत कॉमन होते हैं यंग गर्ल्स के बीच में.
Like,
share,
subscribe
to Dopamine High.
Thank you.
Thank you.